Hello everyone, I am Dr. Beena Jaising, Senior Consultant Obstetrician and Laparoscopic Gynecologist working in Manipal Hospitals on Sarjapur Road and in Mom and Baby Clinic in HSR. Many of you would have heard the word or the term myomectomy. So what is myomectomy? Myomectomy is the removal of the myoma or the fibroid from the uterus. In this procedure, make note and be very clear that the uterus is not removed. Only the fibroid or the myoma is removed from the uterus and the uterus is very much preserved or conserved. This procedure of myomectomy is opted as the choice of treatment in women who wish to preserve the uterus for future childbearing, and also in women who have completed their pregnancies and are not looking at for future childbearing but still want to preserve the uterus for the psychological need of having their menstrual cycle every month. So what is this fibroid or myoma? They are non-cancerous benign growths on the uterus. Based on the position along the walls of the uterus, they are referred to as submucosal when the fibroid completely grows into the uterine cavity. When the fibroid is well within the muscular layer of the uterus, it is called intramural myoma, and when it grows from the uterus outwards into the abdominal cavity, it is called subserosal myoma. Most of these myomas are asymptomatic. They do not cause any problem at all. But few of them can be symptomatic and cause gynecological issues like severe painful periods, heavy periods. Sometimes they can be the cause of not being able to conceive infertility, and rarely they can also be a cause of recurrent miscarriages. So ultrasonogram is the basic diagnostic tool to diagnose a fibroid or the myoma of the uterus. MRI is used when the surgical treatment of myomectomy is opted for. Once the surgical removal of fibroid or myomectomy has been decided for, there are two ways in which we can perform myomectomy. One is through the abdominal route called laparoscopic myomectomy or the open myomectomy, and through the natural vaginal orifice called the hysterectomy myomectomy. The submucosal myoma, which grows into the uterine cavity, is dealt with through the natural vaginal orifice through hysterectomy myomectomy. Since it does not involve any incisions or cuts on the abdominal wall, it has the fastest postoperative recovery period. In laparoscopic myomectomy, we put small incisions or cuts on the abdominal wall and the instruments are introduced in and the myomectomy is performed. So the intramural myoma that grows within the layers of that is confined within the layers of the muscle layer of the uterus, and the subserosal myoma that grow outwards from the surface of the uterus are dealt with laparoscopically. Once it is decided for myomectomy, in the current stages, laparoscopic myomectomy is the preferred choice over the open myomectomy, as the incisions in the laparoscopic myomectomy are much smaller and hence the postoperative pain and recovery period is much faster. Even large myomas can be removed through the small incisions through laparoscopic myomectomy using a special instrument called morcellator.